Hello, everybody. I'm here today with our guest, Dr. P. Please
Hello,
introduce
everybody.
yourself and share with us your credentials.
Okay, so I'm a UK trained clinical psychologist. I have been qualified for nearly 30 years. I have a practitioner doctorate in clinical psychology, which is a bit like a PhD, but it's of a more practical nature. So instead of being a research doctorate, it was a practical taught doctorate that I did. And that's about 30 years ago I did that. So since then, I've been working within the NHS and privately as a clinical psychologist. And I'm also a certified expert witness, and I'm a certified autism assessor.
Wow, you have so many qualifications, and this is
Thank
like
you.
hitting you home, isn't it?
Yes, it is. I mean, the role of the professions, I think, is the worst thing. In particular, my profession, psychology. I'm stunned and shocked and appalled every time I see what psychologists are doing and how we are complicit in this, in what I regard as a crime against humanity and the biggest medical crime the world has ever seen.
Totally,
And
especially autistic children and all the other ones you're trying to protect here. Like, these are the people that go to you.
yes, exactly. These are the people I see because I did a specialist placement in learning disabilities when I was training. So it's something that's close to my heart. And these children are being completely exploited.
When did you
I call, sorry.
I'm sorry. When
No,
was the time you first got into the trans craze? When did they first introduce this to you?
because of various reasons, I was living in the Middle East and they literally blocked Twitter out there, so I couldn't get it.
Oh,
So I didn't know what was going on. And then I returned to the UK, and my daughter, who is now 23, became quite ill. So I spent 5 years looking after my daughter. I will tell you, and that's one of the reasons why I'm driven by what's happened to her. So it was only about a year ago, I somehow did not realize what was going on because I was busy caring for a disabled child. And
a break and this came about.
sorry?
You took a break, a professional break, and then this came around.
Yes, I was basically having a career break which lasted something like 10 years while I was in the Middle East and then looking after my daughter. And I just sort of I remember about a year ago seeing these, stories in the newspaper, and I didn't quite understand what was going on. And to be honest, I would laugh with my friends and say, "Look at this weird story," and we thought it was a bit of a joke. Yeah, until I sort of got a sense of what my professional association was doing and what was happening.
And it told you the guidelines that you now have to follow, right?
Well, they've said that they are going to clamp down on therapists who are not gender affirming.
Which definitely you're not. I would not have invited you here.
Absolutely not. And one thing from when I did my training back in the 1990s, we were always taught that we were scientist practitioners, that we weren't just, even like talking therapists. As clinical psychologists, we were trained to be scientist practitioners, which meant that every intervention we routed had to have its basis in strong empirical evidence.
Right.
Yeah?
And then good ethics where you're not doing harm to, anyone.
Exactly. And then to have this sort of this awful malignancy, which I call transgenderism, I call it a malignancy, to just burst onto the therapeutic scene like this. And I thought, no, there's no way clinical psychologists are going to put up with this nonsense because they know it's rubbish. So
right.
I was completely
people out to help people.
Exactly. And it is harm. There is nothing good about it. In all the 30 years of my clinical experience, I came across one child who presented with gender issues, and oddly enough, he was a little Palestinian lad that was living when I lived in Qatar, and I was working as a sole practitioner there. And that's the only time it got mentioned. And even then, when I took that referral, I didn't realize that it was that what was going on outside of the Middle East. I thought this was a single thing, and so I was very stunned.
And now it's a whole contagion all over.
Well, I've gone from one referral in 30 years to about 20 or 30 a month.
Wow.
Yeah. I work with an agency, and I have told them quite clearly I refuse to do anything that has anything to do with gender. But I see the referrals lists that come through every Friday night, and
you're
about
not
a quarter of them.
On this.
Sorry?
You're not even specialized in this. If you were specialized in this, you'd get like hundreds, right?
Yeah, I would imagine so. I would imagine so. Yeah. So how my profession and how adults cannot see that this is a social contagion is completely baffling.
0 to 100.
Yeah, yeah. 0 to 1,000. Yeah, 0 to light speed. Yeah, yeah.
It's all advertising on the internet.
Yeah, yeah, yeah.
Cool. And for your profession. So, how did you find out about the Wpath?
That was just, sorry?
The organization of Wpath.
Well, do you know what? I didn't really know much about them either until quite recently when I knew that people were following their so-called standards. Right. And I thought this is great PR because there used to be the Harry Benjamin some foundation or something. And it just goes to show that just what a name change can do. You know, they have literally decided they are the World Professional Association, and everyone has gone and said, "Yeah, you are." You
right.
know,
I heard anyone can pay $200 and go on that website. I could be a professional who gives you advice.
Yes, and it's literally smoke and mirrors. It's an enormous long con. Wpath are just carrying out. You know, like the film The Sting, I think it was way back in the 1970s. This is what Wpath is doing medically. They're just carrying out the most enormous long con in medical history. It's a grift.
We make it. Yeah, exactly. There's fetishists on that site that are motivated by like harming children, gets them off. It's been proven that these members are on websites that are dangerous.
Well, you know, I think it's the word professional. Well, both words, the world and professional. You think it's being manned by professionals, but it's not. When I was doing the analysis of it, I think you can pay £200 a year to join, or if you're from a straightened circumstances, you can pay $70 a year.
Oh, discount to be more professional.
So any sort of extremist,
yes,
I don't call them trans rights activists anymore. I call them trans demands activists. Any TDA can just pitch up, pay their fees. I think the most egregious thing about it is that the professionals, the doctors, the endocrinologists, the surgeons, are listening to the trans demands activists. It's the wrong way round.
You don't
the
go to
professionals are listening to the activists. Sorry?
You don't go and have a professional, you know, PhD, so you can learn from a bunch of nobodies, fetishists online.
That's exactly what's happened. But they've given themselves a fancy name, a nice title, a nice website, and they are there. It's a confidence trick. That's all they're doing.
That's the whole trans scam right there for you.
Yeah,
and a lot of money behind it.
Absolutely.
I don't believe billions would back it if it was not profitable.
Well, this is the whole thing, and why, as a clinical psychologist, I am so angry, is that children's bodies have been commodified. We've been turned into human cash machines.
Yeah. Your reproductive systems. Now they all need to buy these things that your body produced, you know, like the hormones.
Yes. Yeah, you have to buy them every month for the rest of your life. So they interfere with puberty to start off with. Then once they've derailed puberty, they then turn you into a lifelong patient for an organism that was working quite well, functioning properly.
10 surgeries plus.
Yeah. We've introduced harm into the organization. It's like when the opioid crisis, when they made pain the 5th clinical symptom, they created a problem and then had the solution to it, which was OxyContin, but a problem they had entirely manufactured. And it's the same thing that's happened with gender dysphoria, with transgenderism. It's exactly the same.
Why is this allowed to continue on?
Sorry?
Why is this allowed to continue on, in your opinion?
Money.
Yeah.
I think it's money. I think I read somewhere that, you know, we're going into it's going to be into the mid-billions of dollars in about 5 years' time, the industry. It's money. That's
billion. Sorry.
Yeah.
Not millions.
Yeah. Yeah, it's capitalism. It's the apotheosis of capitalism. It's you know, we can't get any more capital than the human body being turned into a product. And that's what,
at the expense of children. Yeah.
Sorry?
At the expense of children.
At the expense of children. That's what makes it so inimical and so evil. And I keep putting up these posts saying transgenderism is evil.
Well, because I love your posts, especially about the Wpath files. What have you learned?
Okay, I think the main thing I learned was that it's not a professional association. It is not a medical association. Despite putting out their spuriously named standards of care, Wpath is just a trans extremist organization masquerading as a medical body. I would say that's my main takeaway. And because of the name and because Marcy Bowers is a doctorate, he's in charge of it. People have been fooled into thinking. I would imagine that a lot of people who are following the Wpath standards of care
Right.
don't realize that most of the Wpath members aren't medics. They are activists. So that would be my single most significant takeaway from having read through the entire project that Mia put up, that they're not doctors. We have activists dictating care.
What was the most outrageous violation of ethics that you read about?
I don't know where to start. I would think the most egregious violation was a sort of conceptual one rather than a specific example, which was that the doctors were there saying that their job was to satisfy people's embodiment goals. So they had moved. Yeah, they'd moved away from practicing medicine, even bad medicine.
Plastic surgery.
Yeah. It's medicine has elided into social activism. And I'm not even sure the doctors, all of them, have realized what they're doing. So that would be the underlying conceptual principle.
Right.
I think in terms of specific examples, it would possibly be learning disabled children with low IQ. As I said, I told you, I did a specialist placement on this. Children with who are not cannot conceptualize what's happening to them, being operated on. People with active psychoses, mentally ill. And I think if I were to take up perhaps the most specific egregious example, it would be, I think one of the doctors, they have this thing called what they call a system, which is where you have multiple personalities residing in one body. So somebody with multiple personality disorder, and they want to operate on somebody to do this gender affirming care. And I think one of the Wpath doctors said the only time Mia Hughes said that she saw the ethics being discussed in the entire material was when somebody said, "How do we get permission from all the personalities?"
Oh, no.
And then somebody said, I think one of the other people said, "Oh, they can use an app to talk to each other."
An app? Oh my goodness.
Yes. So this is somebody with what used to be called multiple personality disorder, dissociative identity disorder, clearly in the grip of quite raging psychosis. And the Wpath people thought it was still okay to operate as long as all the alters or all the headmates.
Right. They got together and they compromised. Yeah. This is like, okay, well, this one doesn't want it, but this 5 of them go for yes.
Well, somebody had 85. And the doctors with the Wpath people were saying, how can we get permission from all the 85 headmates?
No, you can't.
At which point you think these people are actually mentally ill. I mean, I worked in a locked ward. I was in a psychiatric hospital. My training many years ago, and I can tell you that they were the people I was looking after on the locked wards were more in touch with reality than the people on running Wpath or their membership. They have completely lost touch with reality.
I think the average person on the street, when I talk to them, has more touch with reality than these professionals that are just blindly just ready to explore and cut up kids, and there's no limits.
Which is why, as a clinical psychologist, I am so annoyed, because I think if there was one profession that could have put a stop to this whole transgender enterprise 15 years ago, it was psychology. And all we had to do was a simple statement saying, nobody under the age of 18 or 20 has the developmental cognitive capacity to make these decisions. We do not recommend them. We cannot, and that would have been it. The surgeons could have said what they liked. The endocrinologists could have said what they liked. But if the psychologists had just said, no, they're children, they cannot make these decisions, that would have put a stop to it. And we didn't.
Do you think it's good for anybody at any age? I mean, they could have stopped doing harm because this is not a real reality-based thing.
No, it's not. It's not. I mean, I do personally believe that gender identity disorder as was is a thing. As was is a thing. But it is of the incidents where I can see one person in 30 years. Every now and again, Mother Nature is going to make a mistake. You know, that's how mutations happen. That's how evolution happens.
Well, it should be a person thinking that there's a mistake. I don't think there's anything actually physically wrong with these people, you know, like.
Yeah, exactly. So no, I don't think for anybody at any stage. I mean, we are trying to we are trying to change the organism. It's impossible.
Right. This is an impossible thing that they're trying to promise to these people, and they're giving them like, okay, informed consent to do this, but they think they're going to get a sex change. That's not informed consent. That is a con job.
Well, not only is it not informed consent, it's not informed consent on the basis that there has been no long-term studies on this. Nobody knows what's going to happen to these children in 20 or 30 years' time. So therefore, they cannot give informed consent. Maybe in about 2060, when we've had somebody who's been on puberty blockers, who is now in their late 50s, they may be able to then say, we've got enough data that we can say exactly X, Y, or Z is going to happen. But nobody can give informed consent now.
I think that's what they're trying to do with the rebrands of Wpath and GroomSpect. I think they're trying to do the studies now backwards, you know, like it's backwards ethics where you do the studies and then.
No, well, they're not. They're not, because they're not. Here in the UK, so basically you can't give informed consent if there's not enough information. And there's not enough information about this whole sex change type procedures, but also not only is there not enough information, is that they are not collecting any information. So like the Tavistock here did no follow-ups.
I believe that they're going to start doing the studies now on select children that they feel like are the selectively good ones, you know, and they're going to.
Well, I'm not sure, but you know what? I think the studies are unethical. I don't think the studies should be done.
It should never happen because there's experiments that you cannot promise something that you can deliver.
But I think there's some experiments that just should not be done, like the studies on male galactorrhea. I refuse to call it breast milk.
No, exactly. It should never be a thing.
It's just ethically wrong. You know, if we discovered that human flesh cured cancer, would we do studies on feeding people to people? We would just say, no, that is not right.
We don't even have that. We have somebody theorizing that it could happen. And let's do it. Is it the
I just think the study shouldn't be done. There is no need for it because these children don't have anything wrong with them. They need psychotherapy. They need time to grow up. They need to be left alone. They need to be ignored. They need to go up to their room and read a book.
Coming to you, and I was telling you that I am not happy with my body and I think I'm the opposite sex. What is the logical thing to tell me?
Well, the logical thing to tell you is you need to reconcile yourself with your body. You cannot be the opposite sex. You are what you are. You are the body you were born into. There wasn't a production error the minute you were born that something got, you know, the wrong consciousness got slotted into your body. You are your body. You have to learn to reconcile your mind and your body. There is no aliens that came and body switched me with some boy. Exactly. Exactly. It's not like a bit of IKEA furniture that was put together wrong. You are who you are. Learn to live in your body. I am a black woman.
Right.
You know, there is no way I can be anything other than a black woman. And, you know, I live with that. I accept that. You know, 1950s or 40s in America, that would have been a massive disadvantage. It's not now.
Right.
If I were to go to any therapist and say, I'm not white, I'm not black, I want to be white, they would say, no, you have to learn to be a black woman.
They wouldn't be trying to give you a pill that says, hey, now you're...
Exactly.
Everybody tell you that you're white. I would have to tell you that you're white too if this was the same trans racial
it's insane.
situation.
And that's what makes this whole ideology so dangerous, because here in the UK, our hopefully not next Labour government is actually trying to criminalise that question. So if a child comes to me and says, I think I might be trans, and me as a therapist, I just say to them, okay, let's do a quick mood screen. Here's the depression inventory. And how have you been, or the childhood depression inventory, if there's no child. And if I give that to that child to just try and screen their mood, to just see if they've got clinical levels of depression or anxiety, the Labour government will try and make that illegal.
Right. So insanity and good advice is going to be criminalized because everyone has to feed into the scam. If not, you're hurting their money.
Exactly. And as a clinical psychologist, on a scale of 1 to 10, a child or an adult with the issues I have dealt with over 40 years, if 10 were the most complex, and I think I'm born in the wrong body is 10 is the most complex, and 0 is the least complex. I think I'm born in the wrong body is about a 2 or a 3 for a skilled clinical psychologist or therapist to deal with. It is not complex. We can help sort that out. So I'm allowed to do all the really, really, really difficult stuff without anybody telling me what to do or how to direct my practice. But this one particular area, they have pulled out and said, you are not competent. We've trained you on the NHS, you've practiced for 30 years, but you're not competent. We have to sit there in the practice room with you.
How much sexual abuse do you think is like hidden by these, guidelines of gender? Because these girls are coming to hide their sexual abuse, right?
What the people that the children who are presenting with gender dysphoria?
Yeah, I think some of them are victims of like sexual abuse, and instead of being able to help them with the sexual abuse trauma, you are forced to deal with the gender thing or turn them away when you could have helped them with their issues.
Exactly. The gender dysphoria, or the fake news gender dysphoria, I call it FNGD, is an expression of a clinical pathology going on. And it's our job as psychologists to find out what that is. And I would say, having looked at the detransitioners and seen their stories, I would say 60% of them, 60 or 70% of them were sexually abused.
Right.
Yeah.
How many of them do you think are gay or bisexual children just going through a phase?
Most, again, a massive number, because this presentation in itself bespeaks of a pathology, because there is no such thing as a gender identity. So there is some sort of pathological process going on, and a lot of the time that is, homophobia, or sexual abuse, or it's a neurodevelopmental problem like autism.
Exactly. So it's basically the people you help.
Exactly. Or you've got the few that are just, wanting attention, but there's always a reason for it. There's always something going, but we are now going to be criminalized as therapists to try and find out what that reason is. It's absurd.
So you'll never touch the reason. You'll never help them with the actual problem. You'll only be able to like medicalize them and put them on a pathway of harm.
Well, I don't know if you saw, I did quite a long thread on the suicide and the ideations and the cognitive distortions that drive transgender ideation. And I personally think we are in for a tidal wave of suicides, because people are going to very shortly realize that the steps they have taken to try and alleviate their distress haven't worked. They are still stuck with those dysfunctional thinking styles that led them to want to transition. But now they've also got a body that's not working properly. So they're going to have chronic pain, the dysfunctional thinking styles, and a body that's breaking down. And they've got nowhere to go at this point. And we're going to see a huge number of suicides. I'm convinced of it.
Do you think that they're trying to put them on the train to assisted suicide to cover up this medical scandal?
Well, I know there's one lady in look, see, I've nearly said it myself. This is how deep the rot goes. A man, a transsexual or whatever, he's a man in Canada who has requested, he's done the sex change, and he's in so much pain. He's in constant chronic pain. And, the Canadians are quite happy to kill anybody, to let anyone kill themselves. But they have refused him. They've refused to let him carry out eugenics. They've refused to let him die. Because it's going to make transgenderism look bad. But he said he wants to die because he's in chronic pain and he can't stand it anymore. Sorry?
I can only imagine when you mutilate your sex organs, eventually you're going to have regrets.
Look, we're all ladies here. I had an ectopic pregnancy about 15 years ago, and as they were catheterizing me, somehow they introduced, I think the stuff wasn't clean. So I've had an on and off urine infection for 15 years, right?
Yeah.
Sorry? And that's just a normal urine infection with my normal, and that's bad enough when it flares up. Every now and again I have to go off to casualty and get antibiotics, and that's a woman's body just doing the normal thing. And what people often forget is when they do all the operations down there, it's not just the genitals, it's a urinary system they're messing about with as well. It's the whole plumbing. And so people are left in chronic pain. They're dribbling urine. They can't pee. I think we're about 500 years away, maybe, from doing this properly.
Yeah.
The medicine is just not there.
Exactly. But they would never allow you to like cut off arms and legs. Why in the world is it different with sexuality and sex?
Exactly. I mean, part of the latter chapters, the last chapter on the Wpath files, Mia discussed, I think it's called aptomemnophilia, where people believe that their limbs don't belong to them.
Right.
And there was a surgeon in Scotland. I think he managed to cut two people's legs off. He did. Yeah. But they back in the mid 1990s, I think it was. But he lost his professional license. He was struck off.
Yeah.
And I've heard of a clinical psychologist. No, I think she was a therapist who blinded one of her patients with drain cleaner.
Because, I heard about that. A trans disabled person.
Yeah. But society, we've said no to that. But this somehow
is this sadomasochism on a professional scale?
It is. But again, I think it comes back to money. Once someone's cut their leg off, once you've made them, I don't know, a wheelchair, that's it. But you can't keep milking them every month for hormones for the rest of their life.
Well, it is a combination of money, but you can do a lot of things to get money. Why do you think this is the minds of the people who created this? What do you think about it?
I think this was. I'm coming more and more towards Jennifer Bielek's view that this is just the prelude to transhumanism. I think they're softening us up because it makes no sense otherwise. It makes no sense that this just emerged everywhere, all over the world, all at the same time. And, nobody knew about this 10 or 15 years ago. So I'm sort of coming to her view. I haven't read her entire thesis yet, but she thinks there is more. Sorry?
I love her work.
Yeah. And she was the first person who, to go back to your very first question, when I first realized what was going on, I now remember it was her. She did a very short 20-minute talk about the billionaires, the Pritzkers and the Arcus Foundation. And I remember sitting there thinking, oh my God, this is a concerted, organized effort that's going on here. This is not spontaneous and this is not natural. So let me just put the light. Oh, try to get some light here. Yeah.
Do you think the scandal will continue on?
No, I don't. I don't think it's going to. Sorry?
You have hope that this is going to turn around.
I do. And you know why? I was just having this discussion with another person on Twitter the other day. We are just apes with big brains, right? Homo sapiens have been around for 300 years. Hominids have been around for 4 million years. And all that time, evolutionary pressures have driven us to be what we are, to be a sexually dimorphic species. And I don't think, well, I know evolution is not going to be, is more powerful than DEI and somebody with a nose ring and green hair.
True.
4 million years of evolution have driven us to where we are. And sooner or later, that human drive to recognize male from female, to know that men are threatening, and to be men are different from women, that's going to override whatever we try and put in place. The analogy I use, there's two things that I always remember when I was doing my psychology undergraduate lectures years ago. I remember them saying that a baby of 1 day old can recognize a male from a female face. And it's not just their mothers. It doesn't have to be the same race as them.
No.
But they will look preferentially at a female face because that's a survival instinct. A woman is going to feed you. And I think
the first thing you know is where you come from is your mother. This is like
mother.
A residual human function out there.
Exactly. This research showed that it could be a stranger. It could be an African baby looking at a Chinese woman or a European baby looking at. They will always look at a female face. So it is ingrained in us. It is in every cell of our body. And the other comparison I use, sorry.
I agree with you highly.
Yeah. And the other comparison I use is when I'm in my turf groups and they're all saying that I'm feeling really defeated, I say, okay, imagine it's 1941 occupied Europe and you're a partisan fighting the Nazis. You're in the south of France somewhere. The Nazis are everywhere. They've taken over everywhere from Stalingrad to Dunkirk, and they, you know, they've got this 1,000-year Reich, and they're you know, they are predominant, they are preeminent, they are all powerful, but it was all gone within 4 years. It was all gone.
So as quickly as it came in, it could just disappear.
I think it will. I think it will.
Because the average person knows who's a woman and who's a man, and they don't want to be like lied to about who they're having sex with, and you know,
exactly.
Things.
Exactly. I was listening to a podcast of a lesbian who said, okay, I took one for the team and I had sex with a trans woman. And she said, everything felt wrong. The skin texture felt wrong.
Yeah.
His smell, everything was wrong. You know, I call it pseudo transition. I don't use the word transition anymore.
No,
these people have pseudo transition. Yeah, it's not real. And I do think, and my husband is a lawyer, and he just said, oh, just wait for the first £100 million punitive lawsuit from Chloe Cole or Stephanie or Lau or one of those people, and it's going to bring it down. And we've had this before with the recovered memory and the multiple personality scandals, and they were brought down by insurance companies losing lots of money.
Money talks.
Money talks. And I think that's what's going to bring this down.
Enough victims. There's definitely going to be enough victims of this, sadly, and they will need to come back to you guys.
Yeah, if we haven't been hounded out of the profession.
Right.
I know it's just a matter of time before I get my true identity gets discovered. Probably by this, but I've got to the point now where I just don't care.
Too small.
When I was about 11 years old, my dad made me read a book which I hadn't realised had such a huge impact on me, and it was The Rise and Fall of the Third Reich. It was a big, thick book. I don't know why he gave it to me as 11-year-old. And I didn't realize how much influence that book had on me. And then when I also went to live in Qatar for 5 years, where the topic you couldn't discuss over there was religion, you know?
Really?
Yeah, you couldn't. And I remember thinking, I'm living in a society where as an atheist, I couldn't discuss being an atheist there.
Right.
And I was going to have a meeting, I'll never forget it, with a group of other mothers, and we were going to meet in the Starbucks in one of the big shopping centers, and somebody contacted me and said, don't go tomorrow morning because the secret police are waiting because you're not allowed to discuss atheism. And I always remember thinking, if I'm ever in a position like this again, where my thoughts and actions are being controlled, I'm going to stand up and fight against it.
While we still can.
While we still can, exactly.
So important. Exactly. I'm so glad to have you on.
Sorry?
I'm so glad to have you on. I've been watching you on Twitter and and
thank you. And I think the last thing about why I do this, I don't know if you've watched Narcos on Netflix.
No, I haven't.
Escobar. Okay. When Pablo Escobar, way back when he started, when he was just smuggling TVs across the border from Colombia to whatever country was next door, people just let him get away with it. You know, he was just smuggling. Right. And they could have stopped Pablo Escobar at that point, and nobody did anything.
They just looked away.
Yeah, they looked away. And I will not look away. I refuse to look away. And I just say, look, if they take away my practicing license, which they probably will, I will do online work. I will do online therapy with DTs. I will run online groups with parents whose children are caught into this cult.
You took a vow about helping people. And
exactly. I will not compromise it. I won't. I can't. I say I would rather go. I used to be a secretary many years ago before I became a psychologist, and I would rather go back and spend all day copy typing letters and booking some bloke's appointments and being his PA, rather than. I will never affirm a child. I will never do it. I will never, ever do it. I won't.
Thank goodness.
Thank you.
I'm so glad there's still ethical clinicians out there.
And you know what? I get contacted all the time by people from all. In fact, just today I got another one from psychologists saying, "Yeah, we agree with you, but we can't say anything. We're scared." Right. Yeah, so people they are out there
and support the truth, regardless. You know.
Yeah, yeah.
That's how we all get through this.
We have to. I have to be able to live with myself. You know, I have to. And I think one of the things that also for me personally, I mentioned my daughter was unwell. She's been bedbound for 6 years. She actually got damaged by the HPV vaccine anyway. So she went from being a really normal, stroppy 16-year-old.
Right.
Just two things happened to her. She took the HPV vaccine, and within a year of that, she was in hospital. So she spent Sorry?
I've never heard about this issue. Please tell us.
Yeah. The HPV, I mean, it was just never realized it. Anyway, so she went from being a normal 16-year-old to spending 2 years in hospital, tube fed, completely paralyzed, unable to move. The only way she could blink was that she could communicate was by blinking letters out with her eyes. This is from a normal 16-year-old moaning about emptying the dishwasher and her brother's coming in her bedroom and wanting to go out. But I think, and she spent 2 years in our local children's hospital in her own side room. And I think of her now with absolute terror, what could happen to her now with men identifying as women on the NHS.
Right.
Yeah. And the ward manager, I'll never forget it, a big fat Jamaican lady, Kel Sarah. She said they're not good. There were 2 male nurses and a couple of healthcare assistants, and she would never let them go near my daughter.
That is so great.
Yeah. So then when my daughter came home, she's a bit better now. And so we have live-in carers for her. And the care manager said to myself, my husband, about 6 months ago, she said that if a man identifies as a woman, he will be allowed to do her intimate care.
Oh, hell no. Over my dead body.
Exactly. And here, because we have the NHS, so my daughter's care costs about £2,000 a week. It's about what, $3,500, and the council, that's all paid for. And she said to me that if my daughter refused to have let's just use their terminology, trans woman do her intimate care, her entire care package could be at risk. The council will pull her entire care package.
This is evil. And the predators will go after this. They will know that they have no other choice. Of
course they will. But she then said to me, I'm a Christian African woman. That's never going to happen. But then I thought, well, what if we get a different manager in who is a trans activist and wants to make a point?
Retaliation against you. I mean, all kinds of shit could happen.
Exactly. But, again, proving that men are different from women, my husband, despite being a very mild-mannered barrister, he just piped up and said, if any man tries to come and do that, I'm going to punch him.
And that's normal men should respond to this.
Exactly. And this is what puzzles me when I see the men in the changing rooms with the little girls. I think, where are the fathers? What are they doing?
Exactly. Where's the logic?
Why are they tolerating this?
And where are the fathers fighting this? Why are they allowing
I know there are some
abuse of the system like this?
Exactly. Where are the men fighting? But again, there will always be a certain number of people who will collude with oppression and authoritarianism. That is the human condition, There's
a lot of women also siding with this against other women and giving away our rights.
This one, I can't remember his name, but he calls it pathological kindness, in that we are programmed as women to be cooperative with each other. That's how the group survived, on the plains of Africa. We had to cooperate to survive. And I think that has been weaponized against us. Our kindness has been weaponized.
Right. And also, the numbers and from authority. If you get a bunch of authority telling you something, people are willing to kill each other,
Yeah, again, this is why my profession, psychology, is let everyone down so badly, because we know, excuse my French, we know this shit. We know the studies on conformity. We know Ash, we know the Milgram. We know what's going on.
Right. So you guys should be seeing above all this.
We should be taking a meta position and saying, no, this is wrong, but we're not. But again, during, Stalin's gulags and stuff, it was a psychologist busy writing letters saying people were mad and sending them off to the gulags and stuff. They were part of the system,
Right. Because you guys are human beings as well.
Exactly. But I would have thought that we would have been able to make a stand against this instead of going hell for leather behind it.
Well, thank you for taking a stand with me.
Well, thank you. I shall continue to do so until everyone's fed up of hearing from me on Twitter. I will not stop. I refuse to stop.
I'm so proud that we have women
like
you for us. And thank you for being on and helping me with your professional take on the Wpath files.
All right. Is there anything else you wish to ask?
Last but not least, if you would like to give your information out to the audience, because I think we would.
Okay, yeah. So Sorry, there's a dog trying to get in. I'm on Twitter at psychgirl211. That's PSYCHGIRL 211. It's a silly name, but when I gave myself, I had like 30 followers last year, and that's what happens when you spend 2 seconds thinking about an online name and not really giving it a lot of thought. So, so I'm now psychgirl211. So you can find me there on Twitter.
I have, and I'm excellent follow. Trust me, this woman spits fire. It's the truth.
I'm the stereotypical angry black woman. That's what I call myself now. I'm very angry all the time.
Angry women here. Angry black women are some of my favorites.
Well, thank you very much. So I'm not going to stop. I'm not going to stop being an angry black woman. I will carry on, and I do think we will defeat transgenderism. I do. It is just too evil. It is too vicious. It is too awful. It is inimical. So it is antithetical to everything that's good about society. It must fail.
It will fail. And slowly the cracks are showing through.
I think so. And I think the Wpath files was, even though people didn't, again, my husband is a lawyer, sorry, before we finish, and everyone was saying, why didn't the BBC cover it? Why didn't this cover it? And my husband was saying, no, that doesn't matter now. None of that matters, because he was looking through it. I gave it, because he's a massive TERF as well. And he said, this is now giving people the ammunition they need for their legal action. That's the important thing about the Wpath files. But I did want to go through it page by page. I wasn't planning to do that when I stopped.
If you're willing to come back, we can have this whole conversation again.
I would love to do that. I'd love to talk some more specifically about the things that were in the files as well.
A month from now, we're going to bring you. So we can go.
Yes, I'd be happy to come back if your listeners have any questions as well.
This is a great pre-run.
Yes, indeed. I'm happy to come back anytime.
Thank you so much. And
thank you very much. Bye-bye to everybody. Bye. Bye.